Hey, everyone. It's
Hey.
Dr. Beckford. Yes, with your Curing Docs. That's right. That's our healthcare platform. Health and wellness is a must, especially for us ladies. Yes, let's at least put together 2 hours a month to put our health and wellness first, right? So that we can be there for all those other folks and for
Mhm.
everything else that we take care of. But on our Your Curing Docs, we have this awesome podcast, Your Care Docs, Docs Who Cure, where I have doctors from all over the world. They stop by, they drop their info, knowledge, aka gems on us on health and wellness information. The biggest part is that they leave their info here so you can know how to get in contact with them if you'd like to be a patient or a client of theirs. And today I'm super excited because I am sharing my best friends with you all. That's right. We've been best friends since the first day of high school. That's way
Yes.
back in 19 of blue. Yes, 19 of blue. That's right. And I am going to share her with you. So I'm going to give you a little snippet and bring her in your Karen Docs fashion, right? So this awesome doc. Yes, she went to medical school at UMD&J, Robert Wood Johnson Medical School. All you RWJ people, hey,
WJ.
that's okay. We love you from the NJMS crowd. Yes, we went to sister schools. That is so awesome. And also, she did her residency at St. Christopher's Hospital for Children in Philadelphia. As with all of my docs are like super awesome. Everyone who stops by here is a super awesome doc. So she did not stop there. She went ahead and did fellowship in pediatric endocrinology at the Johns Hopkins University. Yes, right there in Baltimore. That's right. So today I am honored, pleased, and excited to share my bestest friend. Yes, this is Dr. Doris Fadoju.
Hi, everyone. How are you?
Yes, Fadoju. I will share you with the world.
I'm so glad to be here. Thank you for having me.
Awesome. It is my honor having you on my podcast. Oh my gosh. Alrighty. So I said a couple things out there. I said that you are a pediatrician and
Yep,
you studied pediatric endocrinology. So
correct.
tell us, for those who are probably like, okay, I've heard of pediatrics and pediatric endo, let's just give them a snippet. What is pediatrics and what is pediatric endocrinology?
So, pediatrics is the care of children from birth all the way up until the age of 21. And endocrinology specifically is the study of hormones. So, I take care of kids who have all types of hormone problems like diabetes, thyroid problems, too tall, too short, not starting puberty, going to puberty too early. So, anything that's dealing with hormones, we take care of.
Oh, wonderful. So now we're hearing that, pediatrics and pediatric with hormones. But I need to know, what made you decide to become a pediatrician? And what made you go into pediatric endocrinology?
So interestingly, first, my sister wanted to be a doctor, and she's my older sister. And so I always wanted to do what she wanted to do. And I thought that was, it was cool to be a doctor. And then, but as I kind of got more information about what it is to be a doctor, and I actually really admired my pediatrician, I learned that that's really a cool thing to do. I love kids. I love working with kids. I love seeing them grow up from birth all the way up to 21. And so it was a perfect field for me.
Wonderful. So how did you get into pediatric endocrinology?
Yeah, so that's another story. So I couldn't decide what I wanted to do. I knew I wanted to do pediatrics, but I wasn't quite sure. And then during my med school class, we were learning about diabetes. And actually, I messed up. One of the doctors told me I killed my first diabetic patient. I was like, oh my gosh. And so I went and I studied real hard about diabetes. And I know, theoretically, guys, don't get worried. And so I studied about it and I think, oh, this is really cool. And that's really where my interest started.
Wow. So we're in med school and you're on your rotations and they're asking you all these questions. And that's the thing about med school, it's the theoretical and the practical part all together, right? So we're on the rotations and you're being asked questions. So Dr. or student, Dr. Fadoju at that time, what would you do for this? And your answer was A and the true answer was B.
Yeah, B, C, or D, just not A.
So your interest just you went and being a studious person, someone who wanted to learn more, you went and you delve even deeper. And I love the fact that it started with not just I've always wanted, it's just like I didn't do the right thing. I got the answer incorrect. And I started to dig into this topic. And the more I dug, the more I fell in love with it. Yeah. Right?
That's it. That's exactly what it was. And even, even I say you learn the most when you kind of make mistakes, because you have to go back and see, I don't want to make that mistake again. And that's kind of where you open up, knowledge about the thing. And interestingly, I specialize in something called Turner syndrome, and I kind of fell into that kind of the same way. So so I've learned a lot, and I really enjoy what I do.
Wow. This is wonderful. So now we're talking about, diabetes, and we said that diabetes, you have kids who have diabetes, you've had adults who have diabetes, it's something that's very prevalent. So let's talk about that and delve into it. So we want to get into the different types of diabetes, but before we do, why don't we explain to those who are listening? They hear the term all the time. All they probably know is just sugar, but they might not understand really what's going on. What is diabetes?
Yes. So everybody needs sugar in their body. So diabetes is a problem where you have too high levels of sugar in your blood. So the way I like to describe it is your body needs sugar because it needs it to make energy. It needs it to just run the processes of the body. But that sugar is supposed to be in the cells. And what happens with diabetes is your body either doesn't make enough insulin, or it is not recognizing there's insulin around, and therefore the sugar stays around in the blood. And when it does that, it can't get into the cells. It can't make energy. And so it destroys the cells. And so that's a problem. So that's exactly what diabetes is.
Right. So you're not supposed to be on the outside. You're supposed to be on the inside, sugar. You're supposed to be inside the cell so that we can get some energy, so we can move along. But instead, it is hanging out on the outside. And therefore, the blood sugar level is high. Because what we're testing what's going on the outside, not what's going on the inside of the cell.
Correct.
So now there are a couple of different types of diabetes that we've heard. We've heard it, somebody got type 1 diabetes, or we got type 2 diabetes. So let's explain to those who are listening and those who are watching, what is the difference between type 1 and type 2?
That's a really good question. So type 1 diabetes is a problem where they don't make insulin. So it's an autoimmune attack on the pancreas, which is the organ that makes insulin. So because you don't make it, your body can't push that sugar into the cells, and it stays out in the blood and it causes damage. So the only treatment for that is insulin. Whereas with type 2, your body can make the insulin, but because you gain a lot of weight and you have a lot of resistance, your body doesn't recognize that the insulin is around. So it's almost as if it's not there. But the way to kind of make that go away is to lose the weight. So when you lose the weight, the resistance goes away, and your body says, oh, there is insulin around. And therefore it starts pushing it inside the cells, and it gets out of the blood, and it gets better. So with type 2 diabetes, although you can be treated with insulin, we can also give you medications that makes that resistance go away. But the best treatment is trying to lose the weight.
Right. So there we are. In type 1, insulin I kind of think about it like that boat. Like, that key to open up the door. Right?
Yep.
Blood, you're outside. We need you to get inside. Insulin. Here we go. Open up the door. And there we goes that blood sugar. And we get that right in there, right? Now, with type 2, insulin is there like, hey, I got the key. And the body's like, what are you talking about? I can't see you. Where are you? Exactly. So the insulin is there, but there's resistance to it because it's like, I don't know what you're talking about. So as we discussed, one of the ways is bring the weight down, and then the body's like, oh, there you are.
Yeah, there you are. It's like an aha moment.
Yes. The insulin's able to open the door and bring that sugar into the cell. So great. We know the difference between type 1 and type 2. Now, we hear about diabetes, and then some people really kind of need to know, what are some of the signs of
Yeah.
diabetes?
Yeah, so some of the signs are some of them can be really subtle, but in general, what you might notice is that you might feel super, super thirsty. So not like, oh, I'm just a little thirsty, but I'm thirsty all the time. Like I need to drink. Sometimes you need to wake up in the middle of the night to drink as well. Also, you might notice that you're urinating a lot, and especially during the night when you're asleep. So you have to get up out of bed to go and pee when you never used to do that. Also, people can have a lot of hunger. So they're really, really hungry. And the way I think about it is like trying to fill up a bucket of water, a bucket with water where there's holes in the bottom. So when you have diabetes, there's like holes in the bucket. So no matter how much water you put inside, it never fills up that bucket because the water is just leaking out. So you're urinating out all your calories, and therefore you're more hungry. You're drinking and you're eating. And even despite all that, you're losing weight, especially in type 1 diabetes. So people who have type 1 diabetes can lose a lot of weight, 20, 30 pounds in a short period of time, even when they're not trying. So when you have those things come together, those are the cardinal symptoms or signs of diabetes.
Wow. So, I mean, 20 to 30 pounds.
Oh, yeah. In a short period of time. So like within like a week or 2 or 3 weeks, people can lose that much weight. Yeah. Yeah. But interestingly, type 2 diabetics don't do that. They don't lose weight like that. It's mainly in the type 1 diabetics that you see that.
Wow. And so with the type 1 diabetic, they're losing all this calories. I mean, the symptoms are, similar for both the sugar and increased sugar. So that you're really just urinating. And some patients, I take care of emergent patients. So a lot of my patients are usually adults, and they're talking about the cotton mouth. And you're saying, irrespective of how much they're drinking and liquid intake, they are still just very thirsty.
Yeah, now, they can't quench that thirst.
Correct. And that's exactly what you hear. I can't quench that thirst. And I'm just constantly using the bathroom. They're just constantly urinating. So it's interesting to know that with the type 1 diabetes, in addition to that, you can lose up to 20 to 30 pounds in 2 weeks. When you hear that, it's very alarming.
Oh, yeah, it's jarring. And interestingly, some people don't even recognize it, because when you see a person every day, you don't really pick it up. But it's usually when their clothes are not fitting anymore. They're like, there's something wrong. And that's when they start to put 2 and 2 together, like something's not right here. And that's usually what kind of brings them into the tension. But also, they can start making something called ketones. So you can go into DKA, which is called diabetic ketoacidosis. So when your body can't use sugar for energy, it needs to break down something. So it starts to break down proteins and fat to make energy. And one of the byproducts of that is ketones. And the ketones are acids. So when you build up a lot of acids in the blood, it makes you sick. So then you start having vomiting, you can have confusion, headaches, and people can actually lose consciousness and die if not, picked up soon. So that's a really, really serious sign of diabetes. So if you have vomiting, loss of weight, increased thirst, urinating, then you definitely need to get checked out.
Yes, absolutely. And at that point, you are not feeling well. So that's not the time to really sit and say, okay, let me try to get through this. And a lot of patients that I do see that are coming in with this DKA, a lot of times their heart rates are very high too. You are dehydrated. So amongst everything else that's going on. Now, I know that, we hit upon a little bit of the type 1 diabetes. Most of the times people usually associate that with, children. And even though we know that there are some adults that can develop type 1 diabetes, this is a question. What is the youngest or the earliest age that you've noticed or have seen with someone developing type 1 diabetes?
Yeah, so type 1 can happen at any age. So and with the autoimmune type 1, probably around 2 to 4. However, babies can be born with diabetes, and that's more of a genetic issue. So that's actually something where the body just doesn't make insulin, not because it's an autoimmune process. Your body's not attacking the pancreas, but when the cells were being made, it just wasn't made correctly, and therefore they're just not making insulin at all. So I've actually seen babies with diabetes, but in terms of type 1, probably the youngest is probably about 2.
Yeah. 2 to 4. So now, when you're around 2, your ways of communicating is a little bit different.
Yeah.
So what are some of the ways that 2-year-old who is now exhibiting signs of type 1 diabetes? What are some of these signs that the parent might look out for?
Yeah, that's a good question. So some things that this really the same, except for you might notice it more in their behavior. So for instance, your child may be super thirsty. I even had a child who was actually going to the toilet to drink water because they were so thirsty. Also, and like I said, they're urinating more. So you notice that they usually have 8 diapers a day, but now all of a sudden they're having 10 or 11, or they're starting to leak through their diapers, and they never used to do that. So that is a sign as well. Weight loss is the same. So you might see the child is not gaining weight the way that they should. And also increased hunger. So the symptoms are really the same. They just may not be able to communicate to you the same way, but you'll notice a difference in your child.
Wow, that's interesting. Alrighty, so now, you know, one of the we're in the era where there is a increase in childhood obesity. And with that, we've talked about insulin resistance being one of the additional causes of type 2 diabetes, right? Or I think they're now is considered like non-insulin dependent diabetes and insulin dependent diabetes. So we've been talking about the insulin dependent ones, which is the ones that we've discussed as type 1, and the non-insulin dependent, yesteryear, it was considered to be adult onset. But now we're noticing because changes in habits, and also I'm pretty sure I've spoken to one of our pediatricians here on our Your Care and Docs podcast, and she said that even within this pandemic, you know, there was a difference in the patients who came to see her for their wellness checkup. The 1 year passed, and there was a 30-pound weight gain in just a year. So this pandemic is also, you know, causing we call it the secondary pandemic of the obesity. Therefore, there's this increase now in the insulin resistance, in addition to what was going on prior. So what is it that you're noticing, and what are the ways that we're trying to help this non-insulin dependent population of pediatric population to get treated and understand about what's going on with diabetes in that population?
Yeah, so we kind of try to move away from that nomenclature in children, just because type 2s can be insulin dependent. So unfortunately, there's a lot of studies that have shown that even when they're diagnosed with type 2 diabetes, once they get on insulin, it's hard to get off of the insulin. So they are dependent upon it. Yeah, even in pediatrics. And mainly it's related to the weight gain. So as your former person told you, that yes, we see a lot of kids now who are coming with 30, 40 pounds weight gain within the year. And for instance, like last year, we diagnosed 500 new diabetics. This year, we've already had 500 in the first 6 months, and a good number of them are type 2 diabetics. And so usually you'll start to see type 2 in children somewhere around puberty. So we really don't see kids with type 2 before puberty. If it's before puberty, they're more likely to be type 1. But if it's after puberty or during puberty, they can be type 2. And yes, they generally will be overweight and have a history of a lot of weight gain. So important to keep your child active. I know this pandemic has caused so many things that, you know, we haven't been ever faced before. But if you can, any way you can, keep them active, even if they're doing virtual school, set time periods where they have to be active, you know, make it a part of your schedule, just like you have to be at English at 8 and math at 9, well, exercises at 10, you know, and you want to try to get at least 30 to 60 minutes, 5 days a week of some moderate level of activity. So go outside, jog, run, even if you're in the house, jump rope. You know, there's a lot of good apps out there for kids that will teach them how to exercise, you know, just do what they do on TV, jump around, just something. Stay active, and then watch what you eat. Because when you're at home sitting down, you end up drinking juices and sodas. Take the juices and the sodas out. Instead of drinking apple juice, eat the apple. Instead of drinking orange juice, eat the orange. You know, best ways to be able to get yourself liquid and nutrients and fiber. That's really important.
Wonderful, wonderful. And I think that there was another time when you mentioned something about the 3 Ps.
Oh, yes, the fruits. So fruits that have peas in it tend to be very good for your digestion. They tend to be healthier. So pears, plums, prunes, all those fruits tend to be really, really good. And eat the skin. The skin is really good for your digestion, and it slows down your digestion of all that sugar that you're eating.
Wonderful, wonderful. Wow. There's just so much that's going on. And, that's the thing about the pediatric population. We have a limited time to quote unquote get it right. And then after that, the lifestyle has already kicked in, and some of the changes to the body might be, not all of them will be permanent, but it's there. So if we can get some of these habits in, if you can sign them up for those running around the block, if it is, let's get some, but the thing about the pandemic is that now we have to come up with new and creative ways of doing all of this, while prior we were able to do it before that. Alrighty, so, we've delved into all of this. We're trying to get the kids, get them outside running.
Yes,
we've talked about keeping them active. We've talked about how you got your passion for pediatrics, how you got the passion for pediatric endocrinology, how you've been taking care of these children. Although you are an expert in Turner syndrome, you do take a lot of take care of a lot of children with diabetes. So we've discussed about type 1 versus type 2, which the newer, there's a nomenclature now that has changed. Nomenclature, aka we don't use those words no more. That's a nomenclature.
Doctor speak.
We're not using those words anymore. But let's just go over really quickly. What are you doing for self-care, Dr. Fadoju? What do you do for self-care?
Self-care is so important. I need more time for it. But for me, honestly, it's really just trying to get some rest when I can, take naps during the day, get outside and walk. Like, we're in Georgia, so, sun is nice. At nighttime, it's really nice and cool. So making sure I take a walk at least 2 to 3 times a week and listening to gospel music. Oh, last thing, I love looking at Instagram to look at houses and decor. So that's my little.
All right, what does she do for fun? There you go. If you weren't a doctor, talk about decor. What is it? What you be doing?
I think I answered my question. I'd be an interior designer.
There is the interior designer extraordinaire, along with all of these skills set. She's also pediatric extraordinaire, pediatric endocrinology extraordinaire in the Atlanta region. Now, before we end this wonderful interview, and I'm so honored to have, like I said, my bestie, my best friend here where I am interviewing. So tell us, where can they find you? If everyone's listening, they said, oh my goodness, this pediatrician, she is the one that I need taking care of my daughter or son or my cousin. Yes, someone that I know who has a kid has been diagnosed with some type of endocrinology issue. I want her. You let us know. Where can they get in contact with you?
So the easiest way to get in contact with me is to email me at Kemi, Kemi 717 @yahoo.com. Once again, that's Kemi 717 @yahoo.com.
Wonderful, wonderful, wonderful. Yes. Well, you know that she is a doc who cares, and you will be finding her info and profile on our Your Caring Docs page, Your Caring Docs /docs-who-cares, right? So Your Caring Docs, Docs Who Cares website. Now, I am so honored, like I said, to have her on. So all of you guys who are listening on the podcast, you can find it anywhere that you do listen to your podcast. That is on your Apple, that's your Google, that's your Spotify, that's your Buzzsprout, that's your Anchor FM. And all of this great info will be available on our Your Caring Docs website. That's www.urcaringdocs.com. You'll find this great video on our YouTube channel. So with all of this, I am going to take back my best friend for myself, and I'm going to close this out. Thank you so much, Dr. Fadoju, for stopping by our Your Caring Docs, Docs Who Care. Tell everyone bye.
Bye, everyone. Thank you for having me.
My pleasure.